Good morning, everybody, and thank you so much for joining us on this Monday for the Park Nicollet Foundation annual update with Hayley Mueller. Before I kick things off to Hayley, I will tell you a little bit about her. With more than 15 years of nonprofit leadership experience in the Twin Cities, Hayley Mueller specializes in philanthropic strategy, stakeholder engagement, and board development. She currently serves as Vice President of Advancement for HealthPartners Foundations and Executive Director of the Park Nicollet Foundation. Her previous leadership roles include YWCA Minneapolis, Catholic Charities Twin Cities, and Cristo Rey Jesuit High School. Throughout her career, Hayley has focused on building values-driven teams and advancing mission through meaningful donor and community partnerships. She earned her bachelor's degree from the College of St. Benedict and her master's from Hamline University. Hayley lives in Eagan with her husband, Kyle, their 2 children, and their dog. So without further ado, Hayley, thank you so much for being here.
Great. Thanks for having me, Abby.
Yes,
happy to be here today. I'm going to jump right in, and we will have some time at the end if folks have questions, but consider this kind of a general overview of Park Nicollet Foundation for the year and a little snippet of kind of the current environment that we're in today and how philanthropy plays a role in that. So we're going to jump right in to navigating the healthcare landscape. As you are all, I'm sure, very aware, the healthcare landscape right now is ever changing and challenging. And so we're wanted to talk a little bit today about some of the unprecedented times. So again, most of you are going to be very aware of these pieces, but it's important context as we talk about the role of philanthropy in healthcare. So our medical expenses are increasing. It's straining on patients, it's straining on providers and systems. And so much of that is continues to be kind of unknown what those changes will look like long term. Additionally, as I'm sure many of you have heard, research funding is declining, and research is such a critical piece of the healthcare landscape. It's how we make advancements in our work and how we care for patients. And it also is where innovation comes from, new technologies, new approaches to different types of care and different types of treatment. We also are at a very interesting time in terms of the healthcare workforce. We have a number of physicians and leaders who are of retirement age. And so we're seeing that sort of mass exodus of folks in healthcare and not as many people coming into the healthcare field for their profession and career. And so that's impacting care delivery, but it's also forcing us to think really differently, again, about how do we deliver care in the right place at the right time for our patients and really be smart and innovative about how we're recruiting folks into the healthcare careers, but also how are we keeping people and how are we really prioritizing the well-being of our teams across the system is becoming a really significant priority for us here at HealthPartners. Of course, Medicare and Medicaid are under pressure. There's a lot of reimbursement challenges and unknowns in terms of reimbursement and what that's going to look like long term. We talk a lot in healthcare about payer mix, and the sort of abridged version of what that is how people are paying for their care, whether they have commercial insurance or Medicare and Medicaid. And that mix continues to change as our local demographics change. And certainly as our demographics continue to age, our population is getting older. And so we've got more folks who are on Medicare or Medicaid. And that affects those reimbursements. And there's a lot of unknown in that area right now that we're watching very closely. And then again, that regulatory and policy changes. So much of this is not fully spelled out and hard, and that makes planning very difficult. There's a lot of scenarios that we plan for that don't necessarily have a lot of detail fleshed out. So to say it's unprecedented times is probably an understatement, but I wanted to really ground us in this sort of ever-changing environment that we're in. The ground is shifting beneath us, and we're continuing to focus on how do we provide the very best care for our patients as they come through our doors while trying to navigate some of this unknown as well. So as we talk about innovation, I wanted to name a couple of things that are happening in real time here at HealthPartners that have been rolled out over the last year. We're really investing in digital tools. We know that our patients and members want to be able to access their healthcare information in real time, quickly, and in easy ways. And so one of the examples of that is my dashboard. So any of you who are members of Health Partners will see this when you log in to your Health Partners account. And it truly is just that. It's a dashboard that gives you all of the latest and greatest, your upcoming appointments, your coverage, any reminders for vaccines, to check in for online appointments. Everything is right at your fingertips. So really trying to make access to care as easy and simple as possible. We're also looking at new care models, really aimed at reducing emergency visits and meeting people where they're at, who can oftentimes be high level users. So we've got a couple of primary care clinics that are really targeting those patients who are frequently in our system or in our emergency rooms, trying to really proactively see them in a primary care setting, the right care at the right time for the right patient. And we're seeing tremendous results from that for folks who have really complex needs that do need to be monitored closely, but don't necessarily need that monitoring in an emergency care setting. We've also got lots of research underway, even with an ever-changing environment in terms of government funding for research. Our foundations across Health Partners continue to provide funding for research, and research continues to happen here at Health Partners. We've included a number of different studies in our philanthropic priorities over the last year, including things like opioid use disorder. We've got some primary care and some studies for genetic risk screenings for cancer and personal care. This is my shameless plug for our My Genetics. If you haven't done that yet, that is a program through Health Partners that's completely cost-free, but allows you to have some genetic testing for some of those genetic risk screening. So if you're interested in that, I encourage you to look for that. It's a great opportunity and gives some really important information for your health. We're also expanding our rural residency programs and building new facilities. So our rural residency program is really bringing folks out into rural settings, especially our Wisconsin Valley and central Minnesota, where we have locations, to ensure that our patients are getting great care from residents, but also that our residents are having an opportunity to be exposed to rural settings and the different needs in those settings. So really great to see that work continuing. And then building new facilities. You probably heard about the new Lakeview Hospital in Stillwater that is being built as we speak on 36 and Manning. And that is really intended to keep care close to home, but also to think really strategically about where we're providing different types of care across our system, so that not everybody has to go to regions for critical needs, that we have some of those resources in the Wisconsin and Stillwater River Valley there. It's really important as we continue to see, again, more need than ever in our community for healthcare, but really trying to keep people close to home in convenient settings that have the very best technology. So that Lakeview Hospital is a very exciting project that, again, if you're in the Stillwater area right off of 36 and Manning, you will see that building going up in real time. We're also expanding partnerships across the upper Midwest for integrative care delivery, and then integrating our care teams across the system. So this is the last bullet on this slide, but it is probably should be at the top. It is really critical as we bring all of the care at Health Partners into one system and one care team, so that if you are seeing someone in oncology at Health Partners, that person is really tied in to all of their oncology partners from central Minnesota into the Wisconsin Valley. And really bringing that work together provides that seamless experience for our patients, and helps to ensure that our resources are shared better, so that we can better serve those who come through our doors. So this one care group and integrating our care teams is a really critical change over the last 18 months that we are so excited about, and seeing great strides in that area. Oops, I went backwards. Hang on. Here we go. So innovation and philanthropy. I want to call out a couple of things that philanthropy has allowed us to do. So we have 8 foundations across the Twin Cities, again, central Minnesota and the Valley. And we support initiatives at a system level, but we also support initiatives at our local geography. We are united in the same mission. So our mission is to improve health and well-being in partnership with our patients and community. And but by working together as a system, we're able to share resources, expertise, and innovation to really help advance care for everyone. So I want to show you a little visual of where we're actually located. So what you see here is a map of the Twin Cities and the Wisconsin River Valley, and then in the bottom corner you'll see central Minnesota. So Olivia and Hutch are our central Minnesota locations. Each of them has their own foundation. Park Nicollet supports Methodist Hospital here in St. Louis Park, but also all of our Park Nicollet clinics, Melrose Center for Eating Disorders, Struthers Parkinson Center, TRIA, all of those kind of specialty care centers at Park Nicollet, as well as our primary care and other specialty care locations. Then we have Regions Hospital Foundation in St. Paul. Lakeview, which is supporting, of course, our Lakeview project and the Stillwater area. And then we have locations in Hudson, Amory, and Westfields, also supporting their local geographies. Westfields is in New Richmond, Wisconsin. So we expand a pretty far distance from central Minnesota to the valley. But as we dig into Park Nicollet, so this is just a piece of the Park Nicollet footprint. We really span from Maple Grove all the way down to Burnsville and Lakeville area in terms of our clinic space and specialty care spaces. So a pretty large footprint within the Health Partners footprint. So funding essential operations. This is a change for us. Historically at Park Nicollet Foundation, we have supported projects, we have supported capital, but we haven't historically supported ongoing operations. This is a direct result of the change that we're seeing in our environment around healthcare and in these unprecedented times. The needs are changing within our system. So this year we invested $4.5 million to support operational support across Park Nicollet Health Services in all different service lines. So that included oncology, our Jane Bratton Breast Center, all of our nephrology, and all of our different specialties, to really make sure that our teams had the funding to do with what they needed to do with those dollars to support our patients. So it not only supported that direct patient care, but it also supported our staff, our systems, and resources that make that work happen every day. And it also allowed us to serve more people in a more impactful way with those dollars. So operational support, again, is a shift for us, but what we know and where we're headed is that this type of funding allows us to grow, adapt, and innovate. It is the most flexible type of support we can provide because it really puts the decision making in terms of greatest need in the hands of the people who are serving our patients every day. And it really helps us to create opportunities for real transformation because those dollars are flexible. So this was a really exciting investment we were able to do this year to make sure that folks had access to some of those more flexible dollars. Additionally, we are doing lots of work in maternal care at Park Nicollet Foundation, and that included the purchase of Mama Ann. Mama Ann is a high fidelity mannequin, a pregnant mannequin who can simulate almost every possible scenario in a birthing situation. And so the photo you see here is actually our board of directors and one of our wonderful OBGYNs, Dr. Maharaj, doing a simulation as part of one of our most recent board meetings. But this type of learning is one of our simulation center folks says it's about sets and reps. It really allows our team members to get in there and learn in a safe environment where they can make mistakes, learn from those, but also learn from the kind of ambient environment around them. So in this case, we had some of our board members playing supportive family members. We had some of our board members playing resident pediatricians and different sort of characters in this scene that were able to come in and really act as you would if there was a critical issue in a birthing situation. So having tools like Mama Ann and our other high fidelity mannequins is a tremendous opportunity for our teams to have that real hands-on experience and experience with things that don't happen frequently, those sort of rare occurrences that they might not get on a daily basis, but they having this simulation really allows them to have practiced in those environments. And so we are really proud to support the Simulation Center here at Methodist. We have one, and there's one at Regions as well. But this investment also helped us invest in representation. So Mama Ann is a darker complected mannequin. And that's really important. It's important for our teams to be able to see themselves in the mannequins, but also to see our patients and have it really reflect the people that we serve. So this is a wonderful tool that we're very excited to have supported this year. Park Nicollet Foundation also has our volunteer services team. So that's unique for us. Not all the foundations have volunteer services as part of their teams, but at Park Nicollet we do. And a new position that was created was an afternoon visitor role, and this was really launched as part of a patient well-being project. Being in the hospital can be a very isolating experience, especially if you don't have loved ones or friends nearby. And so this was a noted need by our amazing volunteer services team. And so they started this afternoon visitor position. And this person comes around with a cart, and it's got all kinds of activities, magazines, color books, crafts, different games for folks to play. But they also offer just a visitor, someone to talk to, a welcome distraction in what can be a really difficult time. They also provide warm washcloths, which sounds so lovely and such a nice treat if you're in the hospital. And they also do hand massages, which also are incredibly welcome, and our patients love that. So we've had 14 volunteers for this role, and they've done over 350 hours, over 300 hand massages. I don't know what people are thinking, not asking for one of those, but 300 hand massages and support for patient comfort and healing. So really just a tremendous gift to our patients, and our volunteer services team does such a great job of really recognizing those unique needs of our patients. And isolation is certainly one of them. And they do a great job sourcing these activities, and making sure that our volunteers feel really comfortable in these settings as well, and that they have the training they need to be successful. So that's just another great innovation, quite frankly, that we're doing a little differently. I also wanted to talk a little bit about our music therapy program. So, and then our Daybridge program. So I'll start with Daybridge. Daybridge is a partial hospitalization program for mental health. And what this program is it's a day program where folks come in from 9 to about 4, and they have therapy, they have group therapy, and all different types of activities throughout the day. This is a program that's intended to sort of serve the gap between typical outpatient mental health support. So think, an appointment that you would make at any clinic, and inpatient mental health support. So it's really intended to bridge that gap and be that support for folks who need that step up from regular outpatient appointments, but don't necessarily need to be admitted to the hospital. And so they're in the program for about 3 weeks. There are cohorts. So a typical cohort is about 12 people, and they have all kinds of different therapies and programs and opportunities to really partner with licensed therapists and physicians and each other to build that support. So we have a small program over here in St. Louis Park with work underway to make that a full-fledged space in the coming months. But part of that program is music therapy. And so the foundation this year was able to support getting the Daybridge pilot on the west side of the metro up and running, but also to support all the supplies needed to make sure that music therapy and art was part of that program. And the feedback on that has been tremendous. We know that having that creative outlet is really important for patients, and they've shown great improvement by having access to these types of things. So this is yet another type of program that philanthropy is able to support here at Park Nicollet. Then we also have, of course, our Struthers Parkinson Center, which is world renowned for the work that it does to support Parkinson's patients and their caregivers. That's the other piece that's just really important to underscore that Struthers does so well, is support not only of the patient, but for the people who are caring for that patient. And really having those wraparound services and opportunities to educate and give breaks to caregivers is so, so critically important. And Struthers does this so incredibly well. They celebrated 30 years this year of serving patients and in our Golden Valley location, which is very exciting. But one of our new foundation funded supports is adaptive recreation. So as you can imagine, if you are diagnosed with Parkinson's disease, and maybe some of the activities that you've done are no longer possible in the same way, this adaptive recreation initiative gives folks the opportunity to continue to be active. It's designed to really help them do the things that they've always done, but in a different way. And so we have adaptive snowshoeing, pickleball, golf, and kayaking available to patients. I will also just put a little plug in for the golf piece. So at our annual golf tournament that we do every summer, one of the holes this year had the adaptive golf club, which was so cool to see how they have innovated and really gotten creative around how do we ensure that folks who loved to play golf can still do that in a meaningful way and do that well and have that opportunity to be outside doing those activities. So this initiative is really great. We are so proud to support this work. And we're seeing great results and great interest. And then this one I'm very proud of. This is the first time that we have supported a project that was a system-wide initiative. So when you think about going to see your doctor in a regular clinic, they are often taking notes as you're talking to them. And the note-taking process and that final report is really, really important. Our teams were really looking for a tool to do what we call ambient dictation. And it's essentially recording the conversation and then helping our clinicians and physicians draft up their charting and draft up their reports. And what this allows is for really that patient care to be, eyeball to eyeball, really personal. They're not worried about making sure that they type in all the notes, but instead they can have a conversation with patients. And it frees them from the really heavy burden of the administrative task of that, and allows them to really focus on patients and not focus on trying to remember all of the details. And so this year we invested $5 million to launch ambient dictation for all of HealthPartners. And so it started off in primary care and it will continue to be rolled out across the system. But this is really a transformational technology that's allowing our clinicians and physicians and teams to be really in conversation with the patient in front of them and have that administrative work, have a partner in that administrative work and help lift some of that burden. So lots of faster charting completion, which is really important, smoother workflows, and quite frankly, and most importantly, clinician well-being. This is really, really hard work, and it is taxing and it is challenging, and it is long hours. And so to the extent that there can be a tool that really helps with that clinician well-being and lifting some of that burden, that makes all the sense in the world and really helps alleviate some of that burnout and stress. And so this is a really exciting tool. We are so proud to be able to support this across the system and get this off the ground for our amazing clinicians. So philanthropy in 2026, that was a little bit of a look back that we just had on what we invested in 2025. But as we look at 2026, we've got a couple of goals. So Park Nicollet Foundation, not at the end of 2024, approved a 3-year annual strategic plan. And so we will continue to advance that strategic plan that was really about equitable access to excellent care. And so everything you just saw about 2025 was year one of that work, really making sure that our patients had equitable access to excellent care. So we're going to continue on that 3-year journey and continue forward with that plan. We're also looking to empower our donors, our volunteers, and partners to improve health and well-being and really be ambassadors for Park Nicollet and Health Partners in the community. We're focusing a lot on supporting our colleagues, fostering collaboration, of course, but also really focusing on what I just talked about, the well-being, resilience, making sure that our teams have the support, education, and resources that they need to be successful. We're going to continue to innovate and differentiate. We're trying to stay ahead of the changing landscape. And often that's the role philanthropy can play, is to really invest in those things that are new, those pilots that our teams have come up with that need to get off the ground before they can be operationalized. We love to invest in those types of projects. And then, of course, in excelling operationally, we are working hard to ensure efficiency and sustainability for the work at the foundation and really partnering with our sister foundations across the system to do that work in very new and different ways as we head into the future. So with that, I'll stop sharing my screen and I will open it up if there are questions, Abby.
Yes, well, Hayley, thank you so much for your excellent presentation. And it's just so
Sure.
fun to see all of the exciting updates from this year. I did have a question right off the bat that I was hoping you could clarify. When you had been mentioning the all 8 foundations, how do they
Yeah.
work together? Can you
Yeah.
like shed some light on that?
Yeah, great question. So, like I said, we've had 8 foundations for a long time. Every geography has its own foundation. But over the last few months, we've really been working on what could a sort of shared and centralized model look like for our 8 foundations. So, what we mean by that is we're all doing a lot of the same types of work across our eight separate entities. What would it look like for us to start doing some of that work together? Not the same, but really in partnership. So if we think about things like the annual appeal letters that we send out multiple times a year, we're all doing that. Right now, we're all writing those letters separately. We're templating them separately. We're telling different stories. There's an opportunity for us to come together and really be more planful and efficient and effective in how we put together a template, and then give each of our geographies the opportunity to plug in their own story, their own priority area, their own maybe story from a physician or quote from a physician, but we don't have to reinvent the wheel 8 separate times. This work together will also allow us to be more strategic and approach some of our funders and partners at a system level. We don't do that right now. We don't fundraise from a position of health partners. We fundraise currently from a position of, Park Nicollet Foundation or Regions Hospital Foundation. There is great strength in our collective system. And so working better and closer together will really allow us to leverage that and bring all that thought partnership together and the expertise of everyone on all 8 of our teams to come up with some really great strategies that'll help us raise more dollars to support more patients. That's really what we're looking for. So we're in the midst of that work right now. The messy middle, as I like to call it. But it's really important work, and we're bringing those foundation teams together in some really meaningful ways, which is exciting. So more to come on that in 2026 for sure.
Excellent. Thank you. Let's see. We have another question here. One moment. Do the other foundations also support their clinics like Park Nicollet does? The foundation has been amazing for our clinics.
So we're all a little different, but yes, for the most part, yes. So as you think about, I'm going to use Westfields. So it's Westfields Hospital and Clinic Foundation. So they do support the clinic that's adjacent to them. I think the uniqueness of Park is that we're supporting primary care, all of the primary care locations that are associated with Park Nicollet in a way that the Health Partners clinics don't necessarily have. So to go back to your earlier question, Abby, that I failed to mention this, as we work better together as a system, that's an opportunity for us. Is there are certainly gaps in philanthropy across Health Partners. And what I mean by that is sort of pockets of work that don't necessarily have a philanthropic partner or someone fundraising for them. And so as we think about how do we bring the 8 foundations together, we've been able to identify where are those gaps and how can we really help to make sure that there are people fundraising for primary care at Health Partners. And then, as I mentioned in a very early slide, that one care group, this is why this is important because our teams are working across the system. Our primary care teams, whether they're Park or Hutch or Hudson or Health Partners, are working together as a team. And it doesn't work well to have sort of feast or famine in terms of access to philanthropy. We've got to have people have access to to resources that they can use across the system. And so that's part of this work as well. So the short answer to that question is yes. For the most part, the clinics associated with the foundations are fundraised for and partnered with a foundation, but not all. And so that's we're trying to fill that gap. Great question.
Thank you. Let's see here. What are you most excited about as we head into 2026?
Oh my gosh. Great question. I'm excited for the way that we're thinking differently about philanthropy at Health Partners. I think we're in a new normal. And so how we leverage philanthropy is going to be really important in the coming years. And I think it's exciting to be able to think outside the box and do things differently than we have before and work together and sort of incentivize ourselves to work better together. So I think there's tremendous growth in our future and some really great opportunities for us to raise significant dollars to support our neighbors and the people who are coming through our doors every day. So that was kind of a Pollyanna answer, but but it is how I feel about it. I think there's nothing but opportunity for us, and that's an exciting way to start the year. Yeah.
Awesome, thank you. And we are appreciating these questions. Keep them coming, everyone. Do you know if the Institute will be working with the clinician well-being team to measure the improvement or even stability of clinician mental health or other measures of well-being?
I'm going to answer that question as well as I can. I believe the answer is yes. I think that there's lots of work in partnership with clinician well-being in the Institute. The extent to which the foundations have been part of that up to this point has been, you know, pretty low. That said, I think there's great opportunity, and I know the Institute is really interested in the data around that and has done some great collecting of that information. And I would imagine these first few months and years of the ambient dictation tool will also provide some great data for us to understand what impact, if any, that's having on clinician well-being. So good question. I don't have a terribly great answer for you, but I do know that they're connected and working together.
Perfect, thank you. And I know you started to talk about this throughout your presentation today, but what do you foresee the philanthropic priorities for the Health Partners Foundations being in 2026 overall, if you had to like answer that right now?
Yeah, I mean, I think that we're going to continue to focus on innovation and doing things differently. I think operational support is going to continue to be a high priority. What that looks like, I think, is going to continue to be kind of in development, but we know that that's a great need. And then capital. Capital is a huge and significant need. We're a very capital heavy industry in healthcare. We've got to have the right equipment. We've got to have the right space. And when when the financials are as they are, like that's tight, that it's difficult to make investments in those really, really big projects. So I expect capital will continue to be prioritized as well. And then patient experience, patient well-being. We call it patient special needs at Park Nicollet Foundation, but those things that if we can lift the burden from our patients to really help them not have to worry about the little things and be able to focus on their health and well-being, that's a major priority for us as well and really gets at that equitable access to excellent care. So I think that will continue to be a priority for us as well.
Perfect, thank you. And Hayley, if anybody has any questions after the presentation today, is it okay if I just forward them your way? For those on the call.
Of course.
Oh, good. Perfect. Thank you. Sorry about that. And for those on the call, if you have other questions that you would prefer to ask via email, please feel free to email me at abigail.hoyle@parknicollet.com and or Hayley, and we'd be happy to get those answered. But thank you so much for your time, Hayley, and I hope you have a great rest of your day, everyone.
Thanks, everybody.
Thank you.